My name is Julie Bourque. I am a children's mental health case manager. I have worked as a case manager for 11 years. At the end of the day, our job is to really link our clients with resources and advocate for them in areas that are needed. And I think part of the difficulty that people have with understanding what we do is because the scope of our job is so all-encompassing. Once we get in and start working with families, if we can, justify it under a goal, we can focus on that area. And so that can lead to things that don't necessarily on their face look like they would be a mental health service. But if we're looking at a whole person approach, if a kid's not been to the dentist in 3 years and has a cavity or a toothache, that's gonna affect their mental health and how they feel about themselves. If they have medical issues that haven't been addressed, if they don't have stable housing, if they don't have, if parents are unemployed or they don't have access to insurance, all of those things in the end impact their mental health. We have kids that are hearing gunshots all night, every night, who are trying to come to school and learn. I have kids that have to do shooter drills on the playground, like hit the ground drills on the playground, because they live in some of the more violent areas of Minneapolis. And I can't imagine having that be their reality. But we want to call them a problem when they're in the classroom because they can't sit still and they can't focus and they can't concentrate. Some of them haven't eaten because they don't have food at home. Some of them are taking care of younger siblings. Some of them are missing school to take care of younger siblings because daycare is closed or mom or dad got sick and couldn't do it themselves. There's just really a lack of recognition for the level of trauma that our kids are carrying into the classrooms. And instead of recognizing the trauma that they have endured and experienced in their lives, they're labeled a problem and they're not helped. And I dare say that part of the reason we have so many adults that are needing services is because they didn't get them when they were kids. There wasn't interventions for them when they were younger. Their needs weren't recognized. They weren't able to get proper help when some of the difficulties they end up facing as adults continue to manifest because they didn't get the help they needed as kids. We get to celebrate successes. We meet people a lot of times when they are at their lowest points. Their kids are really in tough places, and as they become more confident in their abilities to be the advocate for their kids, and as the kids become more able to advocate for themselves too and gain a better understanding of what their needs are, it's just really kind of an amazing transformation. And to be able to walk that journey with them keeps me coming back.